helping your students steer clear of drugs. That's today's topic on the Inside Scoop. Hello and welcome back to the Inside Scoop. I'm still David Owen. If this topic hits you hard, make sure you like, subscribe, and click that notification bell. As teens, most of us grew up knowing that drugs were around and available. Back then, a bad decision could cause lots of problems in our lives, but now that same bad decision could be deadly. Here to help us understand this and other differences between then and now is public health analyst from Cobb Douglas Public Health, Jouty.
Hello.
And we're also joined by Kaitlin Burkly, the Executive Director of Georgia Prevention Project. Kaitlin, welcome to the podcast.
Good morning.
So, Lori, let's start off with you. How bad is this overall situation of drug abuse in Cobb and Georgia, I guess?
So, the issue of drug abuse in the nation and in Georgia and in Cobb for the entire population has gotten really, really bad. For kids, it's hard to say that it's really any different than it's ever been. The problem with drugs, though, even though kids may not be using any more than they ever have, the problem with drugs now is that they are worse. They are scarier. For example, if the DEA has reported that cannabis samples that they seized back in like 1995, the concentration of THC was only about 4%. If you then look in 2017, the ones that they seized, it had gone up to about 17%. Nowadays, with all of the different kinds of products that kids can get their hands on to, like gummies and like wax and different things like that.
And vapes, too,
right? They could be up to 90% THC.
Holy cow.
We are seeing a lot more hospital or going to the ER room, the emergency room, because of not expecting the results that they get from when they try a gummy or something like that.
Yeah, I think you provided us with some graphics that show some of this.
Yeah, so we see that it was really low in 2015, and for some reason it spiked back then, and then it started going down, and then it's going back up again. So That's a concerning trend. Another problem is that most people probably have heard of fentanyl. Fentanyl is, according to the DEA, 7 out of 10 of everything of all the pills that they have seized have contained fentanyl. And fentanyl is a very dangerous drug, especially for people who are naive to opioids. They could be taking what they think is a Percocet. They could, just getting a pill from a friend saying, here's a pain pill, it could have fentanyl in it, and that could have deadly results. Yeah,
so you don't, especially, again, the provider makes a difference, right? If you're getting it from a legitimate, like from a drugstore, no problem, right? But if you're doing recreational stuff, you don't know where it's been, as I say. You don't know where it's coming from.
That's right.
And isn't fentanyl, it's a legitimate drug. It's just being misused.
It's a cancer drug.
Okay.
So, yeah, you can get it in the hospital if you're in severe pain, but it's being synthesized now and being put in all kinds of different powdered drugs and pressed into pills and things like that.
So if somebody is in a hospital room and the doctor says, we're going to give you some fentanyl, don't freak out. It's not trying to do you harm. Yeah. Okay, so to kind of summarize, just for my little old brain, things back then didn't have the consequences they have now. And fentanyl is a big part of that picture. THC, the hallucinogenic chemical in cannabis, I guess.
The active, yeah.
Okay, all right. That's the thing that gets you high.
Right, the thing that gets you high. Yeah.
All right. So back then, 5, 15, 20% maybe at best. And then now it's up to 90%.
In those different products that you can get cannabis made into, right?
So you've got the attractiveness of what is containing it, which like gummies. Kids like gummies. They're a snack. You've got the higher potency. And then you've also got the added risk of the unknown possible fentanyl contamination on top of that, right?
So this is a topic that's really sensitive for people. There's a lot of misinformation about fentanyl.
Yeah, that's one of the reasons you're here.
Yeah, so we haven't seen fentanyl in these products. Fentanyl is more likely to be in a pressed pill or something that they're calling heroin. So,
Okay.
or cocaine. It has been found laced in cocaine. So if you're doing street drugs or taking pills from your friends that you don't know where they came from, that's when you have to worry about fentanyl.
Well, and again, the bottom line is just stay away from all of it.
Right.
I mean, it's got so much risk if you cross that line. So don't try to get close to that line. Walk away from the line.
Yeah.
So tell us about some of these. You brought some other graphics with you, and we'll put them up on the screen. I believe one of them is, and you mentioned a minute ago, visits to the ER have risen.
These ER visits related to drug use have a lot to do with THC more than fentanyl. THC and actually it also has to do with intentional self-harm with over-the-counter medications like Benadryl and Tylenol. So we're not seeing a whole lot of kids in Cobb County right now that are being affected by fentanyl. What we've seen, I have another graphic, is that overdoses due to fentanyl have increased in children in Georgia. In fact, fentanyl overdoses have increased by over 800% in kids in Georgia. But we've only had, we've only had 2 or so kids from last year that actually died of fentanyl overdoses. So we don't have a big enough trend to show in Cobb County. But it does happen, and so it's something that we should be aware of because it's happening generally in the kids of Georgia.
Okay. One of the things that we kind of pride ourselves on here in Cobb, academically, we do better than the state average, we do better than the national average on test scores and so forth. How do we stand in terms of the overall drug situation, drug picture? Or do we have any data that shows that we're better in that arena, or is it just
we rank
too?
About the same? Yeah, I mean we're not doing any better or not doing any really worse than the state of Georgia.
But if it's a rising concern, nationally,
right,
and we need to be tuned into that. Well, we've got our guest waiting in the wings here, Kaitlin Burkly of the Georgia Prevention Project. Thanks for joining us remotely. And Georgia Prevention Project, can you tell us a little bit about what that is and what you guys do?
Yes, well, thank you so much for having me on. The Georgia Prevention Project, we are a statewide prevention nonprofit. So we are able to work with young people from middle school age all the way through college, really sharing information with them, getting young people involved in prevention so that we can hopefully prevent some of the substance misuse that y'all have been talking about this morning.
Okay, and one of the things that I kind of failed to address with Lori here is some of those red flags, I guess, or warning flags that families need to be tuned into. Lori, can you give us some ideas of aspects of things, characteristics of abuse tendencies, or who might be at risk for abusing some of these drugs?
Sure. First, I want to say that when we look at risk factors, we want to also remember that there are protective factors, and that you should think of risk and protective factors as like a seesaw. So children can have a lot of risk factors, but if they also have protective factors, they can balance each other out. So I just wanted to say that before I talked about risk factors, so that you know that these are things that we can overcome by just counterbalance by piling on as many protective factors as we can.
So if a parent sees one of these things you're about to talk about in their child, they shouldn't freak out. They should simply say, okay, well, let me tune into what the rest of it says, and then
see
how we compare on the other side.
Right. Yeah.
Okay. All right. Well, go ahead. I didn't mean to interrupt you.
Oh, no problem. So some of the risk factors, and risk factors can be seen in different areas of a kid's life. They can have risk factors just like their individual selves. They can have risk factors coming from their family. Can have risk factors coming from the community, from school. And I think probably the ones that are most interesting to parents would be the individual and the family realm risk factors. So if you see a kid who's really rebellious, I mean,
well, teenagers,
right? So
therefore all of them have
right?
a drug problem. No, that's not what you're saying.
But if you see someone with high impulsivity, if they really like to take risks, if they have difficulty regulating their emotions, or they've had a history of maltreatment, or you see them hanging out with kids who do drugs. But also in the family, if there's a history of family use of drugs, especially a sibling, an older sibling, if you have a family who participates in drugs together, like often you can say to your kid, go get me a beer from the fridge. That's kind of telling them that you have a permissive attitude about substances.
Yeah, and the kid gets used to having a beer in their hand. They might not be drinking it, but they have no second guessing of should they even touch it.
Right. It's been normalized for that family.
Yeah.
And then other things like sometimes when kids are transitioning from like middle school to high school, or those are sometimes particularly dangerous times for kids.
Just because they feel very anxious about it, maybe?
Probably.
Driving motivator?
Yeah, I'm not really sure why. I mean, maybe we should ask Kaitlin, do you have any other
Yeah, we're going to throw the middle school question to you.
For risk factors?
Yeah, can you decipher the mind of a middle schooler for us?
I'll try my best. No, I think it's because they're changing the schools. They're maybe going to lose some of their friend group, be put into a different environment than what they're used to. Maybe it's more academically challenging if you're moving from middle school to high school. So there's just a lot of added stressors that might make someone, when they're transitioning into a new school, a new age group, maybe a little bit more likely to experiment with substances.
Okay, so you were about to launch into the concept of family and what was the other?
Community.
Community. Thank you.
Yeah. So just things like laws that say that you can have a CBD store close to a school, or a package store or something like that, or a lot of times just having festivals, and I don't want them to go away. I really like the beer festivals and things like that, but those things tell kids that this is a normal thing to do in society.
Yeah.
So those are, risk factors that you might need to counterbalance with some protective factors.
And this is an area that I'm sorry, I'm a parent, and this is kind of where my brain goes, but I had one of my kids, and I've got several, ask me, well, why is it okay for an adult to drink, say, wine, as opposed to a kid? Mm-hmm. Do you want to answer that?
I would love to answer this. I think Kaitlin would be better at answering this question. I mean,
we're going to throw all the tough ones to you, Kaitlin.
Their brain development is not complete, but Kaitlin, can you explain a little better than I can?
So it's interesting with brain development, and I think it's something that is very helpful actually for parents to know, because then we're able to talk with our children about how the part of the brain that's fully developed when you're in middle school and high school, it's the emotional part of the brain. So it's involved in all of that risk-taking and emotional reward part of the brain, versus the part of the brain that actually helps you make decisions isn't fully developed until age 25. And so any substance use that's happening is going to alter your brain chemistry, especially if you're in your high school years or earlier, which is why we, as adults, might drink a glass of wine because our brains are fully developed, and so we're not having those negative impacts to the brain.
Okay, so basically, if I could summarize that into I guess what they call an elevator speech, I should tell my kids, because your brain is still developing and chemically it's detrimental or harmful to that development. Is that fair?
Yep, I think that's fair, and I think that's a very helpful way to frame the conversation, especially when we're looking at all of these different substances, whether it's THC, vape products, alcohol. It really covers everything, so it makes that conversation easier to have.
Okay. And vaping is something that has become, I guess, in vogue in schools, and that's a constant battle for us. The Georgia Prevention Project has a role in helping combat that sort of thing. Can you tell us a little more about what you guys do to help us as parents and frankly the teachers and administrators in schools combat this dangerous thing that's been growing?
So our approach at the Georgia Prevention Project is to work alongside young people. We feel like they will have a better approach to talking with their peers. So we have a program called the Teen Action Council, where we work with groups of students, and we've been fortunate to work in Cobb County schools as well. But we really empower them with skills and then opportunities to practice those skills. So leadership development, public speaking, college readiness, all of that sort of thing, but with the added twist of knowing about prevention and really getting involved in how do we combat this issue at the school level or community level or even in our own families.
Well, our audience here is Cobb parents, and so are you guys in every Cobb school, or do you want to be in every Cobb school? We got 112 buildings.
Yeah, so that would be amazing to be in all of the Cobb County schools. Right now, we're just in, it's really word of mouth, like where if we've been in Walton High School and then Wheeler finds out about it, so it kind of just spreads like that as of now. But yes, it'd be great to be in all Cobb County schools.
Well, maybe people watching this can make a request. That'd be awesome. So, Lori, let's go back to some of the positive things you were talking about, the counterbalancing characteristics or, I guess, traits in students' lives, families' lives that help offset some of those risk factors for giving in to drug temptations.
Right. So Kaitlin did mention a few of these things with what the Teen Action Council tries to do. They try to focus on some of these protective factors. But if you look at them again in the same areas of the kid's life, they would be found in the individual selves, in the family, in the community, in the school. So individual, if you look at a kid who has a sense of optimism about the future, if they're able to express their emotions well, if they have a sense of spirituality or of health and they want their body to be healthy, these are things you can cultivate in your kid pretty early on to try to get them to not want to use drugs. Also, but in the family, one of the protective factors is kind of the opposite of what we said before. It's having an unfavorable parental attitude towards drugs, having kids know that you have expectations of them and they include that they won't be doing drugs, that you see a future for them, that you talk to them about their future, that you have a bonded and connected family, things like that. And also in the community, just having them have things in the community that they're dedicated to. Even just like having a sports affiliation that, the coach is saying, if you are caught doing drugs, then you're out of here. And that's something that they're committed to, even if they're not necessarily committed to school, if they're committed to something else. Those are protective factors for them.
To that point, Kaitlin, I understand generally what you guys do, but do you help cultivate that culture in schools of maybe better positive friendships?
Exactly. I think that's a large part of what the Teen Action Council stands for, is creating safe spaces for young people to have these conversations, having positive relationships, and then really impacting their peers within the school. So some of our groups will do what we call positive social norm campaigns, and I know that's kind of just a fancy word, but it's really trying to shift the culture at the school to where we focus on the fact that most young people are actually not using substances. And if you want to be a part of that majority, then you also shouldn't use drugs. So I think just changing the conversation can be really helpful.
Well, and this goes back to the age-old adage that parents tell their kids all the time, and that is, you become the people you hang out with. You choose your friends well, and they will help guide you along life very well. Kaitlin Burkly of Georgia Prevention Project and Lori Jouty of Cobb and Douglas Public Health. Thank you so much for coming in and sharing your expertise, your knowledge. These are points of information that every parent can use. You might feel like you've got the best kid on the planet, and many of you do. Many of us do, but not every kid is perfect. And in fact, I don't know of a perfect kid. So most of us would like to think this is not something that impacts us, but the fact is, the reality is that it likely will in some way. The fact that you're tuned into the podcast means it either already has or it's a concern. And by checking out the resources in the description and show notes and implementing some of these things we've discussed today, you can protect a family member or a friend and help all of us stay safe. If you know someone facing the troubles of addiction or exhibiting some of these behaviors that Lori mentioned just a minute ago, share the podcast with them. Tell the family. Let them know. They might appreciate having these resources available. Thanks for listening to this episode of The Inside Scoop, a podcast produced by the Cobb County School District.